Hello folks, this is Steve again. Welcome to Chapter 19 on infection control, which is an important topic to cover in both 340 and 341. To gain an understanding of the importance of an infection control, you must comprehend the concepts of disease transmission and the body's response to infection. One of the easiest ways to prevent the spread of disease is to wash your hands or use alcohol-based hand sanitizer. The fundamental concepts of this chapter should be used whenever you're faced with an infection control issue. So to go over some of the learning objectives, number one, we want to describe the characteristics of pathogenic microorganisms. We'll talk about that in a minute. Do the following related in the chain of infection. Apply the chain of infection process to the healthcare practice. Compare viral and bacterial cell invasion. Differentiate between humoral and cell-mediated immunity. Summarize the impact of inflammatory response on the body's ability to defend itself against infection. And analyze some of the difference between acute, chronic, latent, and opportunistic infections. So the term disease is defined as a specific illness with a recognizable group of signs and symptoms and a clear cause. We recognize this category many types of diseases: hereditary, genetic, autoimmune, degenerative, communicable. Sometimes a specific disease may fit two or more categories. Any disease caused by the growth of pathogenic or disease-causing microorganisms in the body falls under the category of infectious disease. Now, an unaffected person could be a carrier and transmit a disease to another person. So certain factors are required for an infectious disease to spread. These factors or links make up the chain of infection, which involves infectious agent, reservoir host, portal of exit, mode of transmission, portal of entry, and susceptible host. The first link in this chain is the actual infectious agent itself. It could be a bacteria, virus, protozoa, helminth, or is a worm-based infection, or fungus. Best way for healthcare workers to prevent the spread of disease is use infection control processes. The second link in the chain of infection is the reservoir. The most common reservoirs are people, insects, such as mosquitoes, ticks, animals, water, contaminated water, food, and contaminated instruments and equipment in our offices that haven't been sterilized appropriately. Most pathogens must gain entrance into a host or else they will die. The reservoir host supplies all the conditions needed for microbial growth. Then the chain of infection continues with the means or portal of exit. That is how the pathogen escapes its reservoir, usually through the mouth, eyes, intestines, reproductive tract, nose, ears, urinary tract, or open wounds. Any body fluid excretion usually makes a very sound portal of exit. Use of standard precautions and the correct disposal of contaminated products can help control the ability of infectious material to spread from one host to another. After exiting the reservoir host, the organism needs some mode of transmission, either by direct or indirect means. Direct transmission occurs from contact with an infected person, with discharges from the infected person, such as sneezing, feces, urine, or with infected soil. Direct transmission can include droplet transmission from sneezing, coughing, or even talking, or transmission can be indirect. It refers to the transfer of microorganisms by suspended particles in the air, inanimate objects, such as touching a doorknob that somebody else had touched while their hands were contaminated. Then we have to talk about portal of entry. This is how transmitted pathogen enters the new host through the mouth, eyes, intestines, reproductive tract. First line of defense against pathogenic portal of entry is usually the body's physical and chemical barriers, intact skin, lining of the mucous membranes, and so forth. And then finally, the pathogen needs to find a susceptible host. If the host is susceptible, it means they're capable of supporting growth in the infecting organism. various factors contribute to a host's susceptibility. Genetic factors, quantity of organisms, state of health, stress, poor nutrition, poor hygiene, um, and so forth. So viruses are the smallest of all pathogens. They lead the list of important disease-causing agents, especially in the day of COVID. Viral particles insert their own DNA or RNA into the host cell and then use the cell to help reproduce more viral particles. Viral invasion may not cause immediate symptoms because the host cells infected with viruses can produce a substance called interferon. This protects nearby cells. Interferon leaves the infected cells and acts somewhat like a messenger or Paul Revere, warning the neighbor cells that a virus is coming. The neighbor cells then produce antiviral protein, which prevent the virus from replicating inside their own cells, slowing or halting the infection. A very common mistake in medicine is to provide antibiotics for presumed viral illnesses. Antibiotics do not destroy viruses. The only way to destroy a viral invader is to destroy the host cell. Therefore, treatment for viral infections typically focuses on relieving the symptoms, or palliative treatment. Bacteria are classified according to their shape or morphology. Some bacteria can produce resistant internal structures called spores that make treatment difficult. When bacteria invades the body, the patient can be treated a number of ways. The most common approach is to use antibiotics to destroy the invader or inhibit its growth. We all have non-pathogenic bacteria that reside in various body systems. For example, a harmless form of E. coli lives in the large intestine. This bacteria helps protect against disease by competing for nutrients, taking up space and excreting waste. All these actions discourage pathogens. Some common diseases caused by bacteria include things like tuberculosis, urinary tract infections, pneumonia, and strep throat. As I said before, one of the world's most significant public health problems is antibiotic resistance, and that usually comes from inappropriate prescribing of antibiotics to presumed viral infections or non-bacterial infections. And a lot of that has to do with inexperience on the provider and giving in to consumer demands from patients who it's somewhat of a self-perpetuating process. Resistance occurs when an antibiotic is used inappropriately because over time mutations occur within the bacterial agents that make them resistant to antibiotics. Inappropriate length of antibiotic administration also can contribute to antibiotic resistance. So some of the tenets to help prevent antibiotic resistance include prescribing antibiotic therapy only when it will benefit the patient. It's important to treat the patient with an antibiotic that is specific to the infecting pathogen. Not all antibiotics work on all types of bacteria. And prescribing the recommended dose and treatment during the medication and making sure that the patient themselves are compliant with the proper treatment and length and duration of treatment. Fungal infections typically include things such as yeast infections, jock itch, athlete's foot, and include organisms such as mushrooms, molds, yeast. Yes, mushrooms are funguses. They best grow in warm, moist environments. That's why athletes who tend to sweat a lot and overheat themselves and not change clothes very quickly tend to develop fungal rashes, and they're treated with various antifungal agents. Fungal infections themselves can be somewhat difficult and time-consuming to treat. Protozoa are unicellular parasites that can replicate and multiply rapidly once inside the host. Examples include things which giardiasis, which is typically caused by ingestion of contaminated water with feces, malaria, which is common in Africa and the Mideast. Frequently, these type of infections are seen in tropical climates. Mosquitoes provide great vectors for protozoal diseases as they transmit from one to another. As we said before, so those are some of the infectious agents. Reservoirs are the second link of the chain of infection. Maybe people, insects, animal, water, food must gain entrance into the host or else they will die. Reservoir hosts supplies nutrition for organism to help it to grow rapidly. The pathogen either causes infection in the host or in the case of vector-borne diseases, exit the host in great enough numbers to cause disease in another host. The portal of exit is how the pathogen escapes the reservoir host, either through sneezing, coughing, expulsion of body fluids, bleeding. Exits include mouth, nose, eyes, ears, intestines, urinary tract, reproductive tract. Standard precautions will help you control the spread of infection. We talked about before direct transmission versus indirect transmission. Direct transmission is when you're directly exposed to that pathogen. Many common colds, things like pink eye, such as influenza, are usually transmitted through indirect transmission. For example, I may have a touch of flu. I sneeze into my hand. I walk out of my room, turning the doorknob, and go about my business. I haven't washed my hands yet. Somebody else comes by, opens up that same doorknob without really even thinking about it at all. They maybe rub their eye, rub their nose, and the virus that has been transmitted to patient A on that object on the doorknob now becomes part of the second person's hand, and that's how they become transmitted. Doesn't necessarily involve a direct sneeze or exposure from the source patient. Contaminated objects that contribute to these types of transmissions are often called fomites. So then we have to think about the portal of entry, how transmitted pathogens gain entry into new hosts, maybe mouth, nose, eyes, intestines, urinary tract, reproductive system, or an open wound. We do have some anatomic defenses, including an intact skin, integumentary system, tears, cilia, mucous membranes, and the pH of certain body fluids, such as vaginal secretions, stomach acid. Second line of defense in immune system is the inflammatory process. We'll talk more about humoral immunity and cell-mediated immunity at a later time. But to reduce exposure and reduce the chances or to help block that portal of entry, it's very, very important to have a good understanding of personal protective equipment and universal precautions, such as masks, gloves, gowns, protective eyewear, and so forth. As we've seen over the last 2.5, 3 years with the COVID epidemic, universal precautions and personal protective equipment have become vital resources in the delivery of healthcare. The body has a great way of dealing with infection and trauma by invoking the inflammatory response. This process results in classic symptoms. It starts when the body experiences trauma or is exposed to pathogens. To defend itself, the body starts certain responses to destroy and remove pathogenic organisms and their byproducts. If this is not possible, it will limit the damage caused by the invading pathogen. This process results in 4 classic signs or symptoms of inflammation: erythema, edema, pain, and heat. When the body is exposed to an infectious agent or a foreign substance, cellular damage occurs at the site. Inflammatory mediators such as histamine, prostaglandins, and kinins are released, causing 3 different responses at the cellular level. All 3 actions are designed to increase the number of white blood cells at the injury site. First, blood vessels at the site will dilate or expand, causing an increase in local blood flow, which results in redness and heat. Blood vessel walls become more permeable, which allows for the movement of white blood cells through the vessel wall to the site. The white blood cells begin to form a fibrous capsule around the site to protect surrounding cells from damage or infection. Blood plasma, or the liquid part of the blood, also filters out of the capillaries, resulting in edema or swelling, which puts pressure on the nerves and causes pain. Finally, something called chemotaxis, or the release of chemical agents, occurs, attracting even more white blood cells to the site, like calling in the troops. The increased number of white blood cells at the site results in phagocytosis, or destruction of pathogenic cells. And the white blood cells collect in the area and form a thick white substance called pus. If the pathogenic invasion is too great for localized control, the infection may collect into the body's lymph nodes, where more white blood cells are present to help fight the battle. This causes swollen glands or lymphadenopathy. If the body's too weak or the number of pathogen is too great, then the infection may wind up spreading into the bloodstream, causing a condition called sepsis or septicemia or blood poisoning, which can ultimately affect the entire body. Without appropriate medical intervention, death can occur from sepsis, but we usually try to take steps to prevent that from happening. This is just stuff that we already talked about. So there are different types of infection. When we're talking about an acute infection, we talk about an infection that occurs rapidly and suddenly, but usually lasts a relatively short time. There's usually different phases to an acute infection. First starts off with the incubation period, which is the period of time between exposure to the pathogen and the appearance of the first symptoms. It can be a few days to even a few months. For example, mononucleosis, the incubation period is anywhere from 4 to 6 weeks. Then there's a prodromal period. This is a short period of time when the first symptoms appear. Things like fatigue, malaise, general muscle aches, and low-grade fever. Then at the acute stage, this is when the disease is at its peak and symptoms are fully developed. For example, again, with mononucleosis, sore throat, tonsillitis, swollen lymph nodes are usually your common presenting symptoms. Take, for example, influenza. If anybody's had an influenza, the incubation period may have been 1 to 2, maybe a couple more days before that while you're feeling okay. Then you start feeling that sense that just something's not right. Maybe feeling a little warm, a little tired, a little achy. That's your prodromal period until you develop those full onset of symptoms, the cough, fever, severe muscle aches, fatigue, and that's your acute phase. And then finally you have the declining stage, where the symptoms of the disease start to subside. Chronic infections persist for a long period of time, sometimes even for life. Sometimes some chronic infections may be asymptomatic and they don't present. However, they may still be transmissible. Take example, chronic hepatitis B. A lot of times patients don't present with any symptoms, but the virus is still detectable in blood and remains transmissible throughout the person's life. A latent infection is a persistent infection in which the symptoms cycle through periods of relapse and remission. Common examples would include things like cold sores and genital herpes caused by the herpes simplex virus 1 and 2. Respectively, the virus enters the body, causes the original lesion, then it subsides as the immune system takes over, lies dormant, and usually in nerve cells or nerve roots, until a trigger, such as a stress, such as illness, trauma, or even sunburn, causes it to leave the nerve cell and seek the surface again. Opportunistic infections are caused by organisms that are not typically disease-causing, but cause diseases under certain circumstances. A host with an impaired immune system response, such as those with HIV or those who are on immunosuppressive drugs or chemotherapy, are susceptible to opportunistic infections. These are pathogens that healthy people come into contact with all the time, but never cause a problem. Over time, other persons' immune systems become weakened and diseases result that are not typically seen in patients with healthy immune systems, such as PCP pneumonia and oral candidiasis, or thrush. Gloves, following the principles of standard precautions, summarize the management of post-exposure evaluation, follow-up, and participate in bloodborne pathogen training and a mock exposure event. Apply all the concepts of medical and surgical asepsis to the healthcare setting. Discuss proper hand washing and demonstrate the proper hand washing technique for medical asepsis. Differentiate between sanitation, disinfection, sterilization procedures, and select barrier personal protective equipment while demonstrating the correct procedures for sanitizing contaminated instruments. and most importantly, discuss the role of the medical assistant in asepsis. So in 1987, in response to concern about the increasing prevalence of HIV and hepatitis B, the CDC recommended a new approach to potentially infectious materials called universal precautions. The underlying concept of universal precautions is that because healthcare workers do not know whether a patient has an infectious organism, all blood and certain body fluids must be treated as if they contain infectious bloodborne pathogens. Therefore, precautions must be implemented for all patients regardless of the information available about that person's health history. In turn, universal precautions protect patients from any bloodborne infection by the healthcare worker may carry. So in 2001, OSHA, or the Occupational Safety and Health Administration, developed the Bloodborne Pathogen Standard, which includes universal precautions. The goal of the Bloodborne Pathogen Standard is to safeguard all healthcare employees and their patients who are at risk of exposure from blood and other potentially infectious materials. Items contaminated with any of the following potentially infectious materials require special handling. Body fluids, any unfixed tissues, or any pathogenic microorganism. And you can see just about any type of body fluid can be potentially infectious and lead to transmission of we call bloodborne pathogens, but doesn't necessarily have to be blood itself. Any body fluid that's visibly contaminated in a situation in which it's difficult or impossible to differentiate between body fluids. So now in 2000, Congress passed the Needle Stick Safety and Prevention Act. This was in response to the CDC's concern about employees' risks when working with sharps, needles, scalpels, things of that sort. Employers are required to keep a sharps injury log that describes the device involved in the incident and the details of how and where the incident occurred. Employers must also make available to employees effective sharps management devices, such as things like syringes with self-sheathing needles, needles that retract after use, needleless IV systems. Parenteral exposure includes accidental needle sticks, occupation-related human bites, exposure of non-intact skin, such as cuts and abrasions on the employee's hands. An employer who fails to comply with OSHA's bloodborne pathogen standard could face a maximum penalty of $7,000 for the first violation and up to $70,000 for repeated violation. The bloodborne pathogen standard also clarifies the use of washing or flushing of any exposed body area or mucous membranes immediately or as soon as possible after exposure. This includes hand washing after removal of gloves or other personal protective equipment. Hands should be washed with soap and warm running water when available. When running water is not available, alcohol-based hand sanitizers can be used. Studies have shown that the correct use of alcohol-based hand sanitizers significantly reduce the number of microorganisms on the skin. It also takes less time than traditional hand washing and causes less irritation to the skin. However, there are limitations to hand sanitizers as well. The CDC recommends for adequate hand hygiene are as follows. Visibly soiled hands should be washed for a minimum of 15 seconds with soap and warm running water. Alcohol-based hand sanitizers that contain at least 60% alcohol should be used before and after contact with each patient, and also after removing gloves to prevent cross-contamination among patients and healthcare workers. Use an alcohol-based hand sanitizer properly, applying the label recommended amount to the palm of one hand and rubbing the hands together, covering all surfaces until the hands are dry. Artificial nails should not be worn. Studies have shown that even after careful hand hygiene, healthcare workers with artificial nails have more pathogenic microbes under their nails and on their fingertips than workers with natural nails. Artificial nails also cause nail changes that contribute to the transmission of microbes. Natural nail tips should be no longer than 1/4 of an inch to prevent microbial growth under the nail. That's a board question you may want to remember. Hint, hint. Barrier protection, as we mentioned before, or personal protective equipment, should be used when contact with blood or any other possible infectious material is expected. PPE includes specialized clothing or equipment that prevents the healthcare worker from coming in contact with blood or other bodily fluids. This prevents or minimizes the entry of infectious material into the body. Types of PPE used in the healthcare setting include gloves, gowns, aprons, shoe covers, lab coats, masks, respirators, protective eyewear, and face shields. Gloves are the most commonly used protective personal equipment in a healthcare facility. Gloves must be worn if the medical assistant is at all likely to be involved in any of the following activities: touching a patient's blood, body fluids, mucous membranes, or skin that's not intact, handling items and surfaces contaminated with blood or body fluids, performing venipuncture, finger stick, capillary puncture, injections, and other vascular procedures. Assisting with any surgical procedure. If a glove is torn during the procedure, the glove must be removed, the hands washed carefully, and new gloves put on as soon as possible. Handling, processing, and disposing of all blood and body fluid specimens. And cleaning and decontaminating spills of blood or other body fluids. The same pair of gloves cannot be worn for the care of more than one patient. New disposable gloves must be used for each individual patient. It is improper to go from site to site to site wearing the same gloves because you're carrying the contamination with you everywhere you go. Proper technique in removal of contaminated gloves is essential to learn to prevent cross-contamination and self-contamination. There is a video on your Blackboard site under your course folder that demonstrates the proper method to remove contaminated gloves. This will also be covered in the lab component of your class, and the goal is to minimize exposure to pathogens by aseptically removing and discarding contaminated gloves. Environmental protection refers to minimizing the risk of occupational injury by isolating or removing any physical or mechanical health hazard in the medical workplace. Every medical assistant must adhere to these safety rules. Read warning labels on biohazard containers and equipment. Minimize splashing or spraying of potentially infectious materials. Bandage any breaks or lesion on your hands before gloving. If any body surface is exposed to potentially infectious materials, scrub the area with antimicrobial soap and warm running water as soon as possible after exposure. If your eyes come into contact with body fluids, continually flush them with water as soon as possible for a minimum of 15 minutes using an eye wash unit. Contaminated needles and other sharps should never be recapped, bent, broken, or resheathed. Contaminated sharps should not be processed in a way that requires employees to reach into containers to grasp them. Immediately after use, dispose of syringes and needles, scalpel blades, and other sharp items in a labeled, leak-proof, puncture-resistant biohazard container. All specimens must be placed in a container that prevents leakage during collection, handling, process, storage, transport, and shipping. Equipment requiring repair that has been contaminated with blood or body fluids should be decontaminated before being repaired in the office or transported for repair. Smoking, eating, drinking, applying cosmetics or lip balm, and handling contact lenses are prohibited in work areas where there is a reasonable likelihood of contamination from pathogens. Food and beverages cannot be kept in refrigerators, freezers, or cabinets or on countertops where infectious materials could be present. The bloodborne pathogen standard requires certain housekeeping measures to ensure sanitary work area. Schedule must be posted for the cleaning and decontaminating of each work area where exposure could occur. Documentation of these procedures must include information about the surface cleaned, the type of waste encountered, and procedures performed in the designated area. After accidental spills of blood or body fluids, at the end of each procedure and at the end of each shift, work surfaces must be immediately cleaned and then disinfected with a disinfectant registered with the Environmental Protection Agency, or the EPA. All reusable containers must be disinfected and contaminated on a routine basis. Sharp containers must be kept as close as possible to the work area. Never attempt to reach inside a Sharps container and do not overfill them. Replace containers on a routine basis and be certain that the lid is closed securely before preparing them for biohazard waste disposal. Never pick up spilled material or broken glassware with hands. Brooms, brushes, dustpans, and pickup tongs or forceps should be used. The material should be placed immediately into an impervious biohazard waste container at the spill site. Use an absorbent professional biohazard spill preparation as directed to decontaminate the site. Handle soiled linen as little as possible and always wear gloves or other protective equipment during disposal. Linen soiled with blood or body fluids should be double bagged and transported in labeled, leak-proof biohazard bags. And finally, contaminated materials and other infectious waste must be handled with extreme caution to prevent exposure. Biohazard waste must be collected in impermeable red polyethylene or polypropylene biohazard labeled bags or containers sealed. This waste must be disposed of in accordance with all federal, state, and local regulations. Disposable methods include treatment by heat, incineration, steam sterilization, chemical treatment, or other equivalent methods that will render the waste inactive before they're placed in a landfill. So the Medical Waste Tracking Act set the standards for governmental regulation of medical waste. However, the law expired in 1991. The states were then given responsibility for regulating and the disposal of medical waste. Each state varies in its degree of regulation, ranging from no regulation to strict rules. The following are some examples of regulation covering disposal of hazardous materials. Biomedical waste should be collected in containers that are leak-proof and strong enough to prevent breakage during handling. The containers must be labeled with biohazard symbol. Workers who handle biomedical waste should observe standard precautions. Biologic waste containers and boxes should not be held in a healthcare facility for longer than 30 days. Sharps and instruments intended to cut or penetrate the skin. They include lancets, scalpel blades, needles, syringes, needle combinations. Sharps must be placed in red, hard plastic sharp boxes after use. Sharp boxes should be closed when 3/4 full. Boxes for disposal of chemicals should be labeled with the chemicals' names and any other pertinent data. They must be adequately sealed to prevent breakage or leakage. Each healthcare facility must hire a biomedical waste disposal service whose employees are trained to collect and haul away biomedical waste in special containers, usually cardboard boxes or reusable plastic bins, for treatment at a facility designed to handle biomedical waste. The cost to the healthcare facility for biomedical waste disposal is typically based on the weight of the contaminated items. So it's important not to throw regular garbage into biomed waste disposal units. Hepatitis B vaccination must be available free of charge to all employees at risk for occupational exposure to bloodborne pathogens within 10 days of starting employment. The vaccine is given by intramuscular injection in 3 doses. The second injection is given usually 4 weeks after the first, and the third injection 6 months after the first. Boosters for the Hep B immunizations are not currently recommended. However, if they are recommended in the future, boosters must be available to the employees without cost. After 3 doses of the hepatitis B vaccine, more than 90% of healthy adults and more than 95% of children develop adequate antibody response. Despite this, healthcare workers with a high risk of exposure should still have titers drawn after completing the series to determine whether they have antibodies against the disease. Antibody testing should be done within 1 to 2 months after completion of the vaccine series. If an employee is exposed through an accidental needle stick, a human bite, or any exposure to unbroken skin, or a splash or splatter onto the mucous membrane, such as the eyes, certain procedures must be followed. The following specific steps should be taken after exposure to contaminated waste. Immediately, or as soon as possible, the worker should wash and flush the exposed area and receive confidential medical evaluation. Exposure incident must be immediately reported to the supervisor. The employee must immediately receive a confidential medical evaluation. The provider caring for the exposed employee must receive written details about the exposure incident, including the routes, circumstances, and surrounding the incident. All the documentation related to the exposure must do the following. They must remain confidential. They must not be disclosed to any other individual without the employee's expressed written consent. And they must be kept at least for the duration of the worker's employment plus 30 years. In addition, after the final incident is reported, the patient should be screened and tested for hepatitis B, hepatitis C, and HIV. The employee should receive a copy of the physician's written report within 15 days of evaluation and receive healthcare counseling about the risks and adverse outcomes. The term asepsis means free from infection or infectious material. Medical asepsis is defined as the destruction of disease-causing organisms. By using principles of medical asepsis, we can prevent the spread of disease. The goal is to eliminate or minimize pathogens by following OSHA's bloodborne pathogen standard and disinfecting objects as soon as possible after contamination. This creates a healthcare environment as free of pathogens as possible. Surgical asepsis is the destruction of all microorganisms. This technique is used for any procedure that enters the body's skin or tissue, such as surgery or injections. Anytime the skin or mucous membrane is punctured, pierced, or incised, surgical aseptic techniques are practiced. Everything that comes into contact with the patient should be sterile, including gowns, drape, instruments, gloves. Minor surgery, like urinary catheterization, injections, and some specimen collections, such as blood collection and biopsies, are performed using surgical aseptic technique. Because skin cannot be sterilized, the goal of hand hygiene is to reduce the number of microorganisms. Hand washing uses mechanical friction, soap, and warm running water. Alcohol hand-based sanitizers are also effective in reducing the number of microorganisms. The alcohol kills most microorganisms, but not all. And if the hands are visibly soiled, then hand washing should be done, according to procedure. Normally, two types of microorganisms are found on the skin: normal resident flora and transient flora. Normal resident flora lives harmlessly on the skin. Transient flora includes bacteria, viruses, and other organisms picked up on the hands. Resident flora is firmly attached to the skin, whereas transient flora is not. This means that transient flora is easily removed by thorough hand hygiene, preventing transfer to patients. The most effective barrier against infection is intact skin. If the skin and mucous membranes are intact, medical asepsis can be used for the most non-invasive procedures, such as pelvic and proctologic examinations. Instruments and objects used in medical aseptic procedures must be sanitized and disinfected or sterilized before using on another patient. You'll hear it over and over and over again in any healthcare class. The single most important factor in limiting the spread of infectious disease is hand washing, hand washing, hand washing. Hand hygiene can be accomplished in two different ways. If the hands are visibly soiled, they must be washed using medical aseptic technique. If the hands are not visibly soiled, alcohol-based hand sanitizer can be used. Hand hygiene using the correct technique must be done before and after each patient is examined or treated, and also when stipulated by bloodborne pathogen standards. You must carefully clean instruments and other items used in the healthcare facility before proceeding with disinfection or sterilization. Sanitation is the cleaning process that reduces the number of microorganisms to a safe level. This cleansing process removes debris such as blood and other body fluids from instruments or equipment. This debris can protect the microorganism from disinfection or sterilization. The medical assistant should always wear gloves while performing sanitization. Thick utility gloves will help protect your hands when you work with instruments that have sharp or pointed edges. Gloves prevent possible personal contamination may be present on the articles being cleaned. The procedure should be completed immediately after use of instruments. A separate workroom or the dirty side of the utility room is usually used to prevent cross-contamination of clean instruments and equipment. If sanitation cannot be done immediately, rinse the used items under cold water immediately after the procedure, then place them in a detergent solution. Never allow blood or other substances to dry on an instrument. Sound waves can be used to sanitize instruments. The instruments are placed in an ultrasonic bath of cleaner and water. Sound waves cause the solution to vibrate, which loosens the materials attached to the instruments. Ultrasonic cleaners are beneficial because they do not damage even the most delicate instruments, and workers do not run the risk of accidental sharps injury. Disinfection is the process of killing pathogenic organisms or of rendering them inactive. It's not always effective against spores, tuberculosis bacilli, and certain viruses. Some disinfectant chemicals can kill microbes within a short time, but they're usually hard on instruments. Some chemicals, such as Cedex, are effective enough to kill all organisms, but the usual immersion time for these sterilants is 10 hours or longer. For exam tables and countertop surfaces, there are two common disinfectants, hydrogen peroxide and bleach. Both are low cost and pretty effective. There are many other types of disinfecting agents that are available as well, and it's important to follow the manufacturer's guidelines and what's used in your personal agency. So the Center for Disease Control defines 3 levels of types of disinfectants. There are low-level disinfectants that can kill most vegetative bacteria, some fungi, and some viruses. These are typically used for exam tables and countertops, for example, hydrogen peroxide. Intermediate level disinfectants can kill mycobacteria, such as like tuberculosis, vegetative bacteria, most viruses, and most fungi, but they do not kill spores. Examples of spore-forming bacteria include anthrax and C. diff. Very difficult to kill these agents. Used for non-critical items such as stethoscopes and percussion hammers, example would be isopropyl alcohol. Your high-level disinfectants will kill all microorganisms except large numbers of bacterial spores. Used for semi-critical items such as flexible fibroscopic sigmoidoscope. Some examples include Cidex. Some common errors that can cause chemicals to lose their effectiveness. Instruments that are not thoroughly sanitized. Attached organic matter inhibits or prevents the action of the disinfectant. No chemical can kill unless it reaches all instrument surfaces. Therefore, complete sanitation is completely necessary. The disinfectant solution is left in an open container, and evaporation changes its concentration. The solutions are not changed after the recommended period for the use is expired. Solutions that are not prepared properly or not mixed properly, or the manufacturer's recommended temperature for use in storage is not maintained. Chemical disinfectants cannot be used on skin or tissues because they can damage them, and they certainly cannot be ingested to try to cure yourself from any diseases. Therefore, antiseptics such as alcohol are used on the skin to reduce the number of pathogens. Alcohol is the most widely used antiseptic, but studies indicate that it's not as effective as other products as inhibiting the growth and reproduction of microorganisms on the skin surface. Alcohol tends to evaporate very quickly. Other antiseptic chemicals such as povidone, iodine are effective antimicrobial agents and are safe to use on a patient's skin. They should never be used to disinfect an open wound, however. Sterilization is essential for surgical asepsis. Sterilization can be achieved with moist heat, dry heat, ultraviolet light, ionizing radiation, gas, or chemicals. Medical facilities typically use the autoclave method, which you will see in your lab, which uses moist heat. Steam under pressure in the autoclave offers an excellent method of sterilization because it kills all pathogens, including spores. You'll learn more about this later on in Chapter 9. So, asepsis is one of the few procedures that will directly affect the health of the patient, the provider, and the staff. The spread of pathogens in the ambulatory care setting can be controlled only through the effective, consistent application of bloodborne pathogens, standard and by proper sanitization, disinfection, and sterilization of supplies, equipment, and work surfaces. The medical assistant must develop the skills needed performing aseptic procedures properly. It's important that these techniques be done on such a routine basis that they become an unbreakable habit. The use of disposable items is highly recommended for infection control purposes. However, when disposable equipment is used, the assistant must follow recommended disposal guidelines to ensure infection control. So in some closing comments, the medical assistant should take every opportunity to educate patients about the infection process and ways to prevent the transmission of disease. The best time to instruct a patient in aseptic techniques that can be used at home is while performing the aseptic procedure. Consider these examples. While washing your hands, explain to the patient that this is a routine is particularly important for patients who are very young or old and get sick frequently. Instruct the patients that the hands should be washed before and after meals, after sneezing, coughing, or blowing their nose, after using the restroom, before and after changing a dressing, and after changing an infant's diaper. Advise the patient to carry alcohol-based hand sanitizer and use it as indicated throughout the day. Explain to the patient that coughing or sneezing into a bent elbow is an effective method for preventing the spread of disease as opposed to coughing into their hand or their fist. Instruct the patient in the difference between sterile and clean dressing and bandages. Demonstrate each step in changing a dressing properly and explain how to dispose of contaminated items. A medical assistant can help patients live healthier lives in many ways. For example, here are some more suggestions for teaching the patient about asepsis and infection control. Set up an information table in the waiting room with take-home pamphlets and literature. Mail, email, or post on the healthcare facility's website a periodic newsletter to patients about infection control, especially during flu season and along with COVID as well. Demonstrate and explain aseptic procedures to patients and family members, inviting them to participate. Medical asepsis and infection control in ambulatory care practices gives rise to numerous legal and ethical concerns. Personal discipline is the primary concern in medical asepsis. Typically, the medical assistant is alone when performing an aseptic procedure. Therefore, if contamination occurs, he or she is the only one who knows. If contamination should occur, the medical assistant must start over again with clean supplies. A primary reason for performing aseptic procedures completely and effectively is to prevent the development of nosocomial or healthcare acquired infections in susceptible patients. These infections, which are acquired in the healthcare environment, can be especially dangerous for your elderly or debilitated patients. Ignorance of the various aseptic techniques or carelessness can be dangerous and is inexcusable before the law. So, to summarize, implementing standard precautions throughout daily practice is crucial to the welfare of both patients and the healthcare worker. Please bring any questions to class, post on the discussion board, or reach out to me personally. With that, welcome to week 1 of clinical procedures and medical assisting, and I wish you luck and success in the future of your academics and your professional careers. We will discuss the next chapters next week.